right now, I want to make sure I have people listening to me. If you're listening to the sound of my voice and you are here and you're excited to be here, just go ahead to, put your favorite emoji in the chats. All right. I see a couple of people. I see some familiar names already. Okay. Okay. So once again, good morning for the people who are joining from that time zone. Good afternoon, good evening, everybody, wherever it is you're joining from. Welcome to today's masterclass, where we'll be looking at how you can use your level 3 or your level 5 NVQ to land a health informatics job in 2026. All right. So just before we start this session, I want you to take a moment to invite anybody who you think would benefit from this session in any way. So whether it's a colleague, whether it's someone who already works in healthcare, whether the person works as a support worker, a healthcare assistant, anybody at all that has their level 3, level 5 NVQ, right? And you know that this person is looking to transition from what they're currently doing into a better role. They're looking to break into tech. Just take a moment to share the link to this session with them right now. Very important. All right, because I'm going to be sharing some nuggets that I don't want, people who would benefit largely from this session to miss out on. So share the link to your sister, share the link to your friend, share the link to your colleague, anybody at all, anybody in the healthcare sector looking to break into tech. In fact, even if you don't have a background in healthcare, but you're looking to get into the healthcare sector, just go ahead to share it with them, and then we can get started. So I'm going to introduce myself in a bit, but before I do that, I want to actually introduce Tenalytics to you. So for people who are here that are joining us for the first time, you know what? I think I skipped something. Now, I also want us to, just put our names in the chat. So I even know the people that I'm speaking to today. So put your name, where you're joining us from. And then if this is your first session with us, put a 1. If this is your second session, you can put a 2. So your name, where you're joining us from, and, your number. So for example, Elizabeth, UK, 2 or 1. All right, so I want to see that in the comments right now. So just put it in the chat. I see a question from Mrs. Rogers. What is level 3 or level 5? All right, we'll get to know that as we progress into the session. But I want you to put your name, where you're joining us from, and your number. I see Bassi, you put a 1. I would like to know where we're joining us from. I want to know the people that we have on this session. I want to know the different time zones, people from different regions on this session today. All right, Bassi, I see you. Thank you so much for joining in. Bassi is a new joiner, so welcome, Bassi. Anyone else? I need 2 more people, at least 2 more people, and then we'll start the program proper. I see Emma or Ima, any one of those. I see BQ, 1. All right. Fantastic. Kingsley, UK 3. Fantastic. Kingsley is an OG, apparently. Welcome back, Kingsley. Now, who are we here at Tenalytics? For the absolute beginners, people who don't know about us, and even, the people that know about us, we're introducing ourselves to you. So Tenalytics is a leading educational technology company. And here at Tenalytics, we are focused on providing specialized training in technology skills and also delivering comprehensive data consulting services. Now, what that means in a nutshell is Tenalytics is not just an edutech company. We're also in the consulting space, and we, deliver comprehensive consulting services to different organizations. Now, with over 5 years of building the talent for the technology workforce, we have helped over 3,500 people, 3,500 professionals, just like yourself, just like the people on this call today. People who were looking to break into tech. We've helped them transition not just from the classroom. Now, we did not help them transition from their previous role into the classroom. We helped them transition from the classroom into their first job in tech, especially in the healthcare sector, across the UK, the US, Canada, Europe, Africa, as well as Asia. Now, here at Tenalytics, we are deeply committed to making the technology sector more accessible for you through premium experiential training in data analytics, business analysis, data engineering, data science, financial analytics, HR analytics, agile project management, product design, cybersecurity, and finally, DevOps engineering. Now, these 10 programs that we offer were carefully curated, okay, because we wanted to also make sure that they hit the threshold across the different regions. Now, I'll be explaining more on that, later. Now, we also have a wonderful team of instructors here at Analytics from leading global organizations like McKinsey, like Amazon, like Microsoft, like Apple, and so on and so forth. And these instructors bring a wealth of real-world experience. These are people that have actually been doing the job for a long time. People who have at least a decade of experience, people who have half a decade of experience, on the field. So these are the people that they'll be able to transfer the information, and the experience that they have. And they're also dedicated to delivering an engaging and practical learning experience to you in order to ensure that you receive the maximum value from your investment with us in the future. Now, who's this person that has been speaking to you for the past, 6 minutes? My name is Elizabeth Nana, like I mentioned earlier. For some of the people that have been on my sessions before, I am a product manager as well as a senior agile project manager here at Analytics, and also a clarity coach with half a decade of experience in both product and project management. Now, I would classify myself as a skilled leader and a coach for agile teams, consistently driving impactful results across the different regions and sectors of the economy. Now, as a clarity coach, I have helped aspiring professionals like yourself gain direction, gain the confidence to break into tech, as well as the actionable steps that you need in order to transition into these highly rewarding tech careers. Now, aside helping people gain direction, I've also trained over 1,000 professionals such as yourself across 4 different continents, and my experience also spans multiple sectors, including the health tech or the healthcare sector, health technology sector, the financial technology sector, as well as the educational technology sector, where I have applied my deep knowledge of agile methodologies to help deliver value. Are we doing on this session today? I'm going to show you 3 things. 3 things and 3 things only, and then we're going to call it a day. And we'll get back to, work. We'll get back to the rest of our day. Now, the first thing I'm going to show you is how you can land your first health informatics job with no experience. Now, I'm going to pause there and repeat it because that is very important. I'm going to show you how you can land your first job in health informatics with no experience. Now, whether you are already in the healthcare sector or you don't even have any background in healthcare whatsoever, if you're interested in getting into healthcare, specifically health tech. So when I say healthcare now, I'm not talking about, the bedside, treating patients and all of that. No, if you're looking to get into healthcare and you'd like to work from home, you want a remote job or maybe hybrid, right? So you have more time for your family, so you have more time for your kids. I'm going to show you just how to do that in the next 2 hours. Now, I'm also going to show you how to identify the skills that you must add to your NVQ. If you have your NVQ right now here on this session, I'm going to show you the skills that you need to have, that you need to add to that NVQ that you already have, whether it is a level 3 or a level 5. What do you need to add to your NVQ in order to land your first health informatics job? And finally, I'll be walking you through our upcoming cohorts, starting in February of 2026. All right, now these are the 3 things I'm going to be showing you how to do in this session. I'll also share some, success stories as well as some discounts that we currently have running with you as well. Now, I want us to kill this myth together. Now, these are some of the things that are stopping a lot of professionals, a lot of people, that are interested in breaking into tech. These are some of the things that are stopping them, from breaking into tech. Now, I want you to listen to me and, as I talk about these myths, I want you to identify if you are someone who you have tried to break into health tech, but you have thought about this thing, or you have heard this thing and you're like, you know what, I don't think it's for me because, let me just face what I'm doing. I'm a support worker, I don't really have that background. So let me face what I'm doing. Now, the first myth is I am not technical. Now, I want you to put a 1 in the chat. If you have ever thought to yourself, I cannot break into tech because I'm not a tech person. I want you to put a 1 in the chat if you have ever thought to yourself, I can't break into tech because I'm not a tech person? I see Albert. Let's be honest, this is a very safe space. All right. And this is going to be a very informative session. So I want to identify the people I'm speaking to. So is it just Albert that has thought to himself? I see Daniel as well. Fantastic. One more person before I move on to the next one. You thought to yourself, I can't break into tech. Tech is not for me. I am not technical. Put a 1 in the chat. All right, fantastic. Now let's move on to the second one. If you have ever thought to yourself, I don't have an IT background, where do I start from? I'm an absolute beginner. Put a 2 in the chat. If you have ever thought to yourself, I hear about tech a lot too. I don't even know what tech is. I don't have an IT background. I see Daniel again. I see, okay. These are actually pretty popular myths, so I shouldn't be surprised. Now let's move on to number 3. If you have thought to yourself, I want to break into tech, but I'm in my 40s. Where do I start from? I'm too late. I wish I did this when I was young. Put a 3 in the chat. Herbert, again, fantastic. BQ, fantastic. Okay, Zoom user, I see you. Fantastic. Emma, fantastic. Okay, finally, I see Bolaji as well. Okay, BQ is Bolaji. Great. So now, number 4, the last myth I'm going to talk about. You've thought about breaking into tech, specifically in the healthcare sector. And you've thought to yourself, before I'll be able to do this, I think I need another degree. Put a 4 in the chat for me. Put a 4. If you feel like Emma, okay, fantastic. Anyone else? Daniel as well. So, what we have just been able to get from this particular exercise is that you're not alone. All right. Now you might feel shy. I'm a beginner. What am I doing in this session? I'm not sure this session is for me, but what I've just been able to establish is that you see that thing that you feel like you're going through. There are 1,000 other people, even people on this, not on this session right now, people all around the world going through the exact same thing you're going through. You're not alone. But the truth is, these are the things that are blocking you from unlocking your full potential. These are the things that are blocking you from unlocking your full potential. Now let's move on. What exactly is healthcare informatics? A lot of us, yes, we're seeing, especially because it's on the rise right now. I'm sure if you are in the healthcare sector, you've been looking for jobs, even if you're not in the healthcare sector, especially in the UK, across the different regions, but we're going to focus on the UK today. You have been looking for jobs, right? I'm sure you've come across healthcare informatics, health informatics. You've been hearing about it. A lot of us don't know what exactly it is. Now, healthcare informatics, like the name implies, there's healthcare in it. So what it means is, it means using data, it means using technology, and it means using systems to improve healthcare decisions, to improve healthcare outcomes, and also efficiency. That's what healthcare informatics is. So you are using data, you're using technology, and you're using systems to help improve healthcare decisions. Now, a popular metaphor I like to use when I tell people about healthcare informatics is this. I'm sure we're all familiar with the role of a doctor, what a medical doctor does. A doctor will treat patients, right? Now, the way a doctor treats patients, healthcare informatics, people who major healthcare informatics analysts, healthcare informatics specialists, you don't treat patients, you treat the healthcare system. Now, if you've ever been a victim of the healthcare system, you know that's not the most reliable. That's why right now organizations are looking, this particular role is on the rise. All right, healthcare informatics, specialists, analysts, clinical analysts, public health analysts. These are roles that are on the rise right now. And the reason is what I've just told you, because you'll be able to help to treat the healthcare system. All right, now, I want to also mention that your NVQs are more powerful than you think. I saw someone put in the chat that it has a level 5 health NVQ. And sometimes you just think that it's a certificate. It is more than just a certificate. All right, it is more powerful than you think. And for people on here who are not, in the healthcare space yet, and you don't know what an NVQ is, it is simply a work-based qualification. All right, that's what it is. It's a qualification. It's like your first school leaving certification, right? It's a qualification that proves that you can do a job to a recognized standard, which is why there are different levels. All right. And it's also based on practical skills and also real world experience. So it's not just about the exams. So for example, if you have a level 3 NVQ, what that means is you're a skilled practitioner. That's a skilled practitioner level, hands-on operational work. If you have a level 5 NVQ, what that means is you are probably in a management or senior practitioner level. All right. So we know exactly where to position ourselves. Now, that's why your NVQs are very powerful. Now, it's also very important that I said it before, but I'll say it again because I want it to sink in. Your NVQ is more than just a certificate. Now, your NVQ, what it does is it represents real world healthcare experience. What it means is you have actually worked in the healthcare system, right? For the people who hold the NVQ, you have actually worked in the healthcare system. You have worked with real patients, real people. You have touched real people like yourself and I, flesh and blood, right? You have worked under real pressure. Again, when we talk about the healthcare system, I'm sure a lot of people on here can relate. You have worked under real pressure. You know what it feels like to be in the healthcare system. That is one thing that your NVQ proves. Now, it also proves that you understand processes. You know how things are currently working in the healthcare system. Because you've been there and you've done that. You know exactly how things are working and you know how things are supposed to work, right? So you don't just have an ideal. You don't just say, oh, in a perfect world, this is how it should work. You know how it is working right now. So you know where it is right now. You know if it is on point A and you feel like it's going to be best if it's on point B. You are in the perfect position to make that change, to make that move from, point A to point B. Now, another reason why your NVQ is more than just a certificate is that you understand compliance, you understand standards. The healthcare system is a highly regulated system, and this is a system you have operated in whatever capacity, whether as a healthcare assistant, whether as a social worker, whether as a health worker, care worker. This is a system that you have operated in. This is an environment you have operated in. And you know that safety, you know that accuracy is very important. And then finally, last but not the least, you also have operational insight. This is what I mean by, you know how it works on the ground. You have that first-hand experience. So because you have that first-hand experience, it's going to be very easy for you to spot inefficiencies, to spot problems, to spot loopholes and also gaps because you have lived inside the system. It's like when you have lived in a certain location. And because you have lived in that location, even when you move from that location, if people tell you, oh, I'm looking to move to this location, you're able to tell them, no, the traffic is very bad there, or the service is very bad there because you have lived. That was your reality. You have lived in it. It's not something you read in a textbook. It's something you have done. It's something you have firsthand knowledge and firsthand, experience with. Now, here is the key shift I want you to make here. We have a lot of technology teams, in the tech sector that are struggling. And they're not struggling because they don't know how to write code. Because of course, you are not going to be writing code. All right. You're moving into healthcare right now, health tech. You're not going to be writing a single line of code except you want to. All right. But these tech teams, they're struggling because they have the best developers. They have people who know how to write code, but they don't understand. Is someone speaking? I see a mic unmuted. Please let's make sure all the mics on this session are muted. So, yes. Hi, Daniela. Can you please go ahead and mute mics on the call? I can hear feedback from some mics. So these people are struggling not because they don't know how to code, like I mentioned earlier. They're struggling because they don't really understand the healthcare system the way you would understand the healthcare system. You have lived in that system. You have worked in that system. You have lived the healthcare reality in whatever capacity. So a lot of us, we look down on ourselves. I'm just a care worker. I'm just a, social worker. I'm not technical. I don't think I can break into tech. I'm here to tell you that you can. In fact, you're exactly what these employers have been looking for. Now, that is exactly why your NVQ is so powerful. Now, you're able to combine this NVQ with, analytical skills, whether it is in business analysis, whether it is in data analytics or data science. And that is how you move from where you are at right now into a health informatics role. Now, I feel like I've been preaching, and I want to make sure that I have people still listening to me. I want to make sure that I have people that are enjoying exactly what it is that I'm saying. So I want you to put your favorite emoji in the chat right now. Just a little moral boost. Put your favorite emoji in the chat, any emoji at all. I just want to know that I have people listening to me. Thank you, Frances. Thank you, Willie. Anybody else? Now, this session is being recorded. And in order for you to get the recording of this session, if you'd like to have a replay, if you're currently busy, you're at work, you're not really paying attention, there is a particular link that my colleagues have been dropping in the chats, right? It's the link to the attendance form. We're recording this session. And once we're done, after this session ends, we're going to be sending the recording of this session as well as the slides I'm using right now to the people who fill that link. So we need you to click on that link and fill the attendance form, put in your details. It is strictly so we have your details and we can send the recording of this session to you. Now, if you're not interested in the recording, you're not interested in the slides, feel free to skip, okay? But I'm going to tell you that I have a lot of wonderful resources linked to these slides that I feel like you'd like to see. So make sure to click on that link, fill the attendance form so that you know guaranteed you're going to get the slides as well as the recording of this session. Now, moving into a health informatics role with your NVQ, it's not about you starting from scratch. Don't think about it that way because you're leveling up, you're upgrading. You already have some skills that recruiters are looking for, and you don't even know that people are searching for you like you are gold. All right. So you're not starting all over. You're not starting from scratch. I don't care. Now I'm going to mention this. I don't care if you don't have a technical background. In fact, I'm speaking to the people who don't have a technical background. I don't care if you're an absolute beginner. I don't care if you were a teacher before. I don't care if you were an operating manager before. I'm here to tell you, if you want to do it, you can. If you're interested in the healthcare sector, if you have your NVQ, even if you don't have your NVQ, you can move into this if you just follow the strategies I'm going to be sharing with you right now on this session. Now, I also have some recent, some success stories that I'd like to share with you. So you know that there are people who have been there, done that. And I made sure to add the pictures of these people. Very important. So we see that they have one head. There are people who look like you and I. The people who have been able to, make this transition. We have Pavel, for example, who had experience, as a field service analyst in Arizona. All right. Now, Pavel joined the Analytics Data Analytics program. He completed his program. He got multiple interviews. And he was finally able to secure a job as a healthcare data analyst with the Arizona Community Physicians in Arizona, in the US. So in as much as we're talking about the NVQs right now, this is not just relegated to the UK. Very important that for you to know that regardless of the region you're joining us from, whether you're joining in Europe, whether you're joining from the US, whether you're joining from Canada, this also applies to you as well. These are people that have done it before you. And I also have the testimonies or the testimonials of these people linked on my slide, which is why it's very important to fill the attendance form. All right. We also have someone like Ikmat, who again, all right, Ikmat she did not even have an NVQ. So for the people who don't have an NVQ on this session, they're like, maybe this session is not for me. Listen, Ikmat worked in customer service and she was able to move into a data analytics role in the UK, not just in the UK, a role that offered full visa sponsorship with the NHS. Now, Ikmat used to be a full-time stay-at-home mom. She moved to the UK for her master's and she joined our data analytics program and she was able to secure a job as a data analyst with the NHS, which came with full visa sponsorship. Again, it doesn't matter what your goal is. It doesn't matter if you don't need a job that offers sponsorship. Whether you want a job that will afford you remote work, you want to be working from home, you want to be working 2 days at the office, 3 days at home, you want to be working, you want a job that will offer you full visa sponsorship, or maybe you don't even need the sponsorship, you just need a job. This session, again, is for you. All right. Now, you're going to realize that there are similarities on my slide. If you look at Pavel, I talk about how Pavel made that switch, and you look at Ikmat. The first thing Ikmat did was Ikmat decided to learn. Now, this is a strategy, a tested and trusted strategy. When I started this session, I mentioned how we have helped over 3,500 people transition. This is a strategy that we have used time and time again, tested and trusted. All right. Now, the first thing Ikmat did was Ikmat decided. She said, you know what? I am so much more than a full-time stay-at-home mom. Yes, being a mom is a full-time job on its own, right? But I want to do more. All right. I want to do more for myself. So the first thing she did was she identified the program she would like to go for. And it turned out it was the data analytics program. Now, after ICMAT identified the program, she joined the 10 Analytics Data Analytics program. The next thing she did was she packaged herself. Now, she was able to tailor a CV, to fit the roles that she wanted to apply to. She joined mentorship sessions. She got prepped for multiple interviews. Now, that's also something I'm going to shed more light on. It doesn't matter how many interviews you get. If you get 100 interviews, we'll prep you 200 times. Quote me anyway. You can record the sound of my voice right now and, so that you can use it to challenge anybody later on. I said it. Elizabeth said it. If you get 100 interviews, we'll prep you 200 times because the goal is that you get that job. So we are going to make sure that your confidence level matches your skill. Because of course, when you go through this training, you are going to have a skill. It's a non-negotiable. All right. Now, ICMAT got prepped for multiple interviews. She also was able to build a portfolio using the projects that she worked on in class. Now she began to apply to multiple jobs consistently. I always tell people it's not magic. You don't just do it once. It's not something you just apply to one job and then you're waiting and you're like, oh, yes, I'm going to get this job. You don't do it that way. It's a numbers game. You want to be very strategic, but you also want to make sure you're applying to multiple roles. All right. Now, she applied to multiple jobs. She made sure she tailored every single application. She knew where to apply to and how to apply. Now, that part is very important because it's not enough for you to just know, oh, okay, I want to apply on LinkedIn. A lot of us don't even know the right places we should be applying to. And that's the truth. We don't even know where to find these jobs. And then when we find the jobs, when we stumble across the jobs, we don't even know how to approach the application. And that is why a lot of us apply to jobs and your application gets flung out because you're not applying the right way. Again, just stick with me till the end of this session. Now, in October, ICMAT was able to land a job. October of last year, she landed a job as a data analyst with the NHS. This is someone who did not have any healthcare experience in the UK. She got a job 2 months after completing her program. Now, I've talked about this three-pronged approach. You want to first learn, you want to package, and then you want to apply. Now, when it comes to health informatics, yes, here at 10 Analytics, we offer 10 different carefully curated programs, but I'm going to drill down to just 3 because here, as far as I'm concerned, the people on this call right now listening to the sound of my voice, you should be just concerned with 3 of these programs. Now, those 3 programs are data analytics, data science, and business analysis. Every other thing for in healthcare informatics. Now, you want to pick which of these roles best suits you. And of course, during the course of my presentation, I'll also be explaining how you can identify which of these ones should you be going for. Which of these roles should you be thinking about? And then the next thing you want to do is you want to package yourself. Packaging is very important. I always talk about how when you walk into a supermarket, you're doing your regular grocery run. There is always that time when you are on the aisle and you see, yes, you have a list, you have a tight budget, but you see something in a very beautiful packaging and you stop and you pick it up from the aisle to even just look at it. What is this? What does it do? What are the ingredients? What exactly is this? And you're like, maybe I'll try it. I don't have the budget for it right now. Maybe I'll buy it the next time I come to the supermarkets. That's exactly what packaging does to you. And that's why you see a lot of these products, they have a lot of shiny packaging. That's what packaging does. Packaging catches people's attention. Because the truth is, you could have all the skills in the world. If you're not packaged properly, nobody's going to look at you a second time. All right. So when we talk about packaging here, we talk about employability. And when I say employability, what are the skills that I'm referring to? These are services that we offer. We're going to revamp your CV for you. So even if you're wondering right now, I'm a support worker, how do I do it? Not to worry. We will revamp your CV for you. We're going to teach you how to optimize your LinkedIn profile, strategically position yourself on LinkedIn to land these roles. Because a lot of times, a lot of our participants, especially people that land jobs during the training, they land their jobs on LinkedIn. I would say 60% of them get their jobs from, our job ads, our job board, because we do have a premium job board that is only available to our participants. Again, when we talk about knowing where to apply to, we have a job board, carefully curated premium jobs that we pay to get. We pay to get these job boards and, these jobs, and then we put it on the job board and we send it to you. So now we are going to also work on your CV and send the CV across to you, the CV you use to apply to said job. We'll teach you how to optimize your LinkedIn so that even as much as you're out there applying to jobs, recruiters are also head-hunting you on LinkedIn. You're going about your business, you get a message on LinkedIn, asking you to say, oh, I came across your profile. I was really impressed. I would like to have a conversation with you. If you don't mind, we have an opening in our organization. That's how some people land jobs. All right. We'll also teach you how you can build a portfolio and house your project on the portfolio. You have access to mentorship sessions. You're able to speak to mentors, people who would guide you through this path that is completely new to a lot of us. You also have the interview preparatory sessions I mentioned earlier. We're always available, 101% available to prep you for any interviews that you may get. We also offer job reference letters if you need recommendations, if you need reference letters, and we offer on-the-job support. Now, that is it on the packaging. And the next thing you want to do is you want to apply like a machine, but you want to apply with precision. So don't say because Elizabeth said you have to apply like a machine, you're just spraying your CV everywhere. No, you want to be very precise. You want to be very strategic with your applications. You want to make sure you are tailoring every single application to fit the job. Now, if you joined this session at the beginning, when we're playing the testimonials, we had someone just like yourself speaking, and he talked about how that was a tactic that helped him. That was a technique that he used. He was tailoring. So what he would do every time he wants to apply to a job, he would take a look at the JD. Now, there are some keywords on that JD that the regular schmegular person would not know. Now, you don't know that there are some things on the JD that if you don't have on your CV, nobody is going to look at your CV. So we're also going to teach you how to identify these keywords and how to make sure that you add these keywords to your CV. So that by the time you apply for those jobs, your CV is among the ones that is shortlisted. Then you also want to make sure you're sending at least 10 quality applications per day, and you're tapping into both the paid, the free, the hidden job markets. And that's where we also come in, because you don't have to worry about that. You don't need to start paying to, get access to jobs. Once you're one of the, you're part of the 10 Analytics family, you also have free, unfettered access to jobs that you would naturally have to pay to get access to. Now, using this approach, learn, package, and apply. That is how you get your first role in healthcare informatics in 2026. But you know what? Let's drill down. Now, I've talked about learning. You want to make sure that you are getting crystal clear on the targeted roles. Very important, all right? So I mentioned 3 different programs that you should be interested in, 3 different programs that you should be asking yourself questions about. And these are the career paths with real security, mind you, real security that will land you a job fast in 2026. Now, these are career paths that we did not just come up with. All right. There was a lot of thoughts that went into this. It was very intentional. It was very carefully curated. We also carried out a lot of analysis across the different job boards. You have LinkedIn, Indeed, Glassdoor, Monster, Built-in, and so much more. We took a look at all these different job boards and we looked at jobs that, had the highest number of listings, because that's how you'll be able to identify how a role is very high in demand. So if you see that, they're looking for clinical data analysts in the entire 2025, in the UK alone, there were about, let's say, for example, 105,000 postings for clinical data analysts. What that signifies is that is a role that is very much in high demand. So we had to carry out this analysis across the different job boards. Then the next thing we did was we decided to seek external validation. We didn't just want to say, we carried out this analysis and that was what we did. We found the World Economic Forum because we were on the hunt to find a forum that has no affiliations whatsoever with Analytics, a forum that does not even know that we exist. Let's see what other people are saying about this particular, career path or these particular jobs that we have shortlisted. And that was how we found the World Economic Forum. Now we took a look at the Future of Jobs report for 2025 and even going into 2026. I also have this report linked on my slide. All right. So make sure to fill the attendance form. Click on that link. If you have not clicked on the link, scroll up right now, click on that link that my colleague sent, put in your details so that we can send this slide to you. And then we also carried out regional analysis. That's why I mentioned earlier that, yes, we're talking about NVQs, but this is not specifically tailored to the UK alone. Now, we took a look at jobs, in the UK. And we wanted to make sure that these jobs are jobs that are eligible occupations for the skilled worker visa. All right, just to make sure that if that is something you're looking out for, these jobs qualify. We took a look at the US and we saw that these are job titles with the highest H1B, acceptance rates. We also took a look at Canada. So just to show you that, there was a lot of thoughts, a lot of strategy, a lot of planning that went into it. And we came up with these 3 programs you can see on my screen right now: business analysis, data analytics, data science. Remember, if you're looking to get a healthcare informatics role in 2026, this is what you should be concerned with. Okay, now let's move on. We took a look at, I mentioned earlier the World Economic Forum. I just took a snapshot. That's a snapshot on my screen. This report is linked on my slide. So if you're interested, once you get the slides, you are able to access this report and actually take a look at what they said. Now, in the next 5 years, by 2031 at least, about 170 million jobs will have been created, while about 92 million jobs will disappear. There's a snapshot on my screen right now in, color codes. We have the red boxes, we have the blue boxes, and we have the green boxes. All right. Whatever it is that you're doing in this life, you want to make sure life does not catch you in the red zone. You want to move away from red, move to blue, or move to green. All right. Now let's move on with that. I also went ahead to just say, for some of us on this call, I know we don't have the time to go over this report. So I went ahead to take screenshots, just little snapshots, and then also just to identify, to see what the World Economic Forum is saying. Now, what this report is showing is jobs that are growing in demand. These are not jobs that, okay, maybe it's just popular this year, but maybe by next year or in the next 2 years, my job would have gone. AI would have taken over my job. These are jobs that are purported that even in the next 5 years, they will only keep growing. So if you have 1,000 of these jobs available right now, by next year, you probably have 5,000 of these jobs. In 2 years, you probably have 10,000 of these jobs available. It's going to keep growing. And you want to make sure you are getting in early. You don't want to get in when, everybody's already doing it. You want to make sure you're one of the first people to get in. We have the data analysts identified here. We have the data scientists identified here. We also have the business analysts identified here. This is just to show you that we validated what it is that we are saying right now. We went ahead to validate it. Now, again, I've not gone ahead to, explain these 3 different careers yet. So if you're still stuck, you don't know business analysis, data analytics, data science, you don't know which of these 3 to go for. What I'm going to do now, there's a very fun quiz. It's going to take you less than 1 minute, or let's say 2 minutes, to fill this quiz. Right? A very fun, very interactive quiz. So what I'm going to do right now, I'm going to put the link to this quiz in the chat. All right? Put the link to this quiz in the chat, and then what you just need to do is click on that link. Very important. So you are able to make up your mind. You're able to figure out which is the between career for you between the 3 careers that I mentioned. So click on that link, take the quiz. It's going to take you 2 minutes, and then you should be good. All right. My colleague Oluwadamilola just put the quiz in the chat as well. All right, let's get back into our session. Now, moving on. We talked about learning. How exactly do you learn? When I say learn now, I'm not talking about YouTube. I'm not talking about going for all these, free courses and all of that. You want to make sure that you're also, in as much as you get live sessions, right? Instructor-led sessions, just like this, you're able to speak to your facilitator. All right. Now, there's going to be a difference. Of course, once you get into the program, you're going to be able to raise up your hand. You're going to be able to unmute your mic and actually speak to me. You're going to speak to your facilitator. You can ask whatever questions it is that you have. So in as much as you have someone walking you through all of these things, holding your hand, assigning projects to you, and also guiding you on how you can carry out this project, how you can build your portfolio. You have a real human you can talk to, you can reach out to anytime. You have direct access to that person on WhatsApp. In as much as you have that, you also have self-paced learning materials. Because again, we are very busy people, especially for people who work in healthcare right now. You understand how crazy the shift can be. All right. So we want to make sure that we're not bombarding you with too many classes every time. Attend a class, because of course you're working. You need to put food on the table at the end of the day before you land your dream tech job. So you also have materials made available to you where you can learn at your convenience anytime and anywhere, whether you are in the train station, whether you're in the bus station, whether you're on the train on your way to work. You can plug in and you can listen, watch these videos, learn from these materials at any time. And if you have any questions, remember, You have direct access to your facilitator. I'll be talking more on that as we move on. Now, the next thing you want to do is you want to package yourself. But I've been talking about packaging a lot. I also feel the need to mention that, yes, while you need to create a magnetic profile for yourself before you start packaging, because some people might take my words out of context and she said we need to package. Let me get a lot of certifications. Before you start packaging, you also need to understand the reality of the job market. Competence over credentials. Any day, anytime. Proof of concepts over you just having one certificate, one exam that is very possible you didn't even write the exam by yourself. Maybe you paid someone to write the exam for you. Recruiters will always pick confidence or competence, all over credentials or certifications anytime. All right? The era of certification is completely over. Nobody cares. Yes, you see some job descriptions. They'll say, oh, you need to have XYZ certification. The truth is, even if you have that certification, you don't have the skills for that job. You're not going to get the job. It's not magic. All right? Nobody really cares about your certifications right now. What you need to focus on is showing or showcasing your skills and your experience. All right, now this is something from Elon Musk. I'm sure a lot of us on here know Elon. Very popular, public figure. And this was when, of course, this is not related to healthcare, by the way, but I saw it and, I thought about it and I thought it was very funny. And it's something that I also needed to share on this session. Now, Elon says, if you are a hardcore software engineer and you want to build the everything app, he was building an app. And he says, you know what, if you are a software engineer and you feel like you are hardcore, you have the skills, please just send us your best work. Basically, send us your portfolio. That's what he's asking for. And he drops the email. Say, if you feel like you have the skills, send us your portfolio. We don't care where you went to school. I don't care if you went to Yale. I don't care if you went to Harvard. I don't care if you have worked at Amazon or any big name company. I don't care. All right, that's not what I'm looking out for. I'm just looking out for your portfolio to see if you have the skills. It says, we don't care where you went to school. We don't even care whether you went to school at all. We don't even want to know. Did you go to school? Did you not go to school? We are not interested. We don't want to know what big name company you have worked at before. Just show us your code. Where I come from, we'll say, show workings, show evidence, show proof. All right? That you can do what you say you can do. That's all we need. Now, the era of certification is over. I just wanted to point that out. So before you start packaging, very important that you take note of that. Now let's take a look at the story of Hope, right? Hope was one of our students and she already had a project management certification. I just brought this here just because of the certification bits. She had a certification already, but she was not able to land a job in Canada. And she was wondering, I have this certification. I have this certification that a lot of people are looking for. Why can't I land a job? But she tried and tried and tried for so long and she was unable to land a job. Now she joined our program, in September. Now this happened actually in 2024, but she joined our program in September of 2024 and she got a job in December of 2024. Let's do the math. September is the 9th month of the year. December is the 12th month of the year. She got a job within 3 months, right? And she secured a job in Canada. Now, why you might be asking yourself, she had the certification before. Why did she not secure a job? The reason she did not secure a job is she did not have proof of work. She did not have proof of experience. She did not have a portfolio to show recruiters and say, look, I've worked on multiple projects. And these are some of the projects I've worked on. I can walk you through some of this project. Because again, when you work on something by yourself, and you do it over and over again, even if you're sleeping and you're tapped, and they say, can you tell us about this project? You're able to talk about it, and you're able to talk about it with confidence. Now, these recruiters are looking out for these things. During interviews, they're assessing not just what you're saying, they're assessing the level of confidence you're using to say it. Because when you're talking about something that you did, even when they try to ask you trick questions, because you did it yourself, you can defend yourself. That is how you land a job, not through certifications. All right. Now, in order for you to be able to package yourself, right, in order for you to be able to have a magnetic profile, a job-ready profile, you want two things. You want to first build a portfolio and you want to be employable. That's where employability skills come in. If you don't have employability skills, you're not employable. If you're not employable, nobody's employing you. I'm sorry, but that's the truth, right? Especially if you're looking for high-paying jobs. You want to make sure you first build a portfolio to showcase your work. All right, all of the fantastic work that you're going to be doing in class, because we're going to be giving you live projects to work on. You're going to get to work on projects. Now, you need to have a portfolio to showcase that project or those projects. And then you also need to have the employability skills, a good CV. Your LinkedIn has to be optimized. You need to know how to navigate the job market. You need to know how to answer interview questions. You need to have a job reference letter when you are asked for one. You need to be able to get on the job support. If you land a job and you get that first month, you're still shaking. You don't really know how to go about your job. You don't know, you get a task and you can't tell them that I don't know how to do it. Who can I call? You can call 10 Analytics. You can dial 10 Analytics anytime, and we'll provide you with on-the-job support, provide you with weekly mentorship sessions, all right, to get you on the straight and narrow, and also Upwork optimization sessions for people who are looking to freelance as well. This is how you package yourself. Now, the third point is to apply, and apply like a machine. I mentioned earlier, you want to make sure you are tailoring your application. Never reuse a CV when you're applying to jobs. You see all those on LinkedIn, you see what we call it, I think it's called quick apply or fast apply, right? And sometimes a lot of us on here, we're guilty of that. When we want to apply to jobs, we're specifically looking for those jobs with easy apply. I think that's what it's called, where you just click on a link. Okay, put your name and then you are done. You have applied. It's not, you don't just want to be going for that. You want to take your time, sit down, tailor your CV to fit that application, that job description. And then that is how you're able to tailor every single application, send in at least 10 quality applications daily and tap into paid and leading job markets. Now, we pay for a lot of premium job boards like, the UK visa jobs. All right. A lot of these jobs, a lot of these boards where you have to pay, whether it's $20 a month, there's a subscription fee, $40 a month, $50 a month, in order for you to have access to those jobs. And the reason you have to pay is because they're premium jobs. So of course, they're telling you, we're not going to give you these jobs for free. You have to pay. Now you're paying, you don't even have the guarantee that you're going to land a job, but you're already spending money. Now, 10 Analytics is telling you, you don't have to do that because we'll do it for you. So we have subscribed. We spend a lot of money every month. I'm going to be very, very transparent. We spend a lot of money on these subscriptions every single month. Now, we have subscribed to these job boards, and what we do is that you just come in. Don't worry about paid jobs. Now, we paid for them, and then on a weekly basis, we go on these different job boards, and we scrape these job boards and send you the links to these jobs to apply. So those people think they are very smart, putting it on. We're going to go there, we're going to get the links, and we're going to send it to you to apply. And you can see a snapshot of one of the spreadsheets that we use to send jobs to our participants. You see the job title, the name of the company, where the job is located, if the job offers sponsorship, if it's a remote job, a hybrid job. So you know exactly what you're looking for. Imagine us sending you a list of 50, 100 jobs, and we're telling you, look, these jobs, these are the ones that offer visa sponsorship. These are the ones in Canada. These are the ones that are remote. These are the ones that are hybrid. All you have to do is go through the list, say, I'm interested in this job. Click on the link and apply. That's all you have to do. We're going to provide you with different types of jobs across the different regions, Africa, Asia, wherever it is that you have. We'll provide you with premium jobs that you can apply to. And then, of course, mentorship sessions, right? So you can see another snapshot from one of our classrooms. You see the documents, key strategies to applying and getting to jobs, video recordings. You have lifetime access to all of these resources. All right, this is how you're able to, again, go through this, this strategy I talked about. Learn, package, and apply in order for you to land your job. Now, there are also free jobs you can apply to. But as much as there are free jobs you can apply to, there are paid jobs as well, which is where the 10 Analytics job board comes in. So make sure you are filling the attendance form, complete the attendance form, get access to the slides, because I also linked some of these resources on here where you can, go ahead to get some free jobs that you can apply to once you get the slides. All right, now, I'm going to be breaking down these different programs shortly, but if you're going into data analytics, data science, business analysis, here are some of the roles that you can get into. Clinical data analysts, health informatics analysts, patients data manager, pathology analyst, data pathology analyst, patients insight analyst, bioinformatics scientist, med tech data scientist, health AI engineer, health analytics, public health scientists, public health analysts, healthcare process analysts, operations analysts. The list goes on and on and on. All right. If you're targeting anything in healthcare, like I said, these are the roles you should be interested in. All right, now we have people who were medical practitioners, and were able to transition into tech. You have people like Evelyn who transitioned from being a nurse for 15 years. This is to tell you that whether you're a midwife or you're a nurse, on this call right now, and you feel like, I'm not a technical person, I can't do this. She was able to transition from being a nurse for 15 good years to getting into a data role in tech. All right. And she was able to transition easily because of her background. We have John Doe, who transitioned from being a medical doctor to a data analyst. We also have Tony, who transitioned from being a pharmacist to a data analyst. We have, people from the arts background. So let's not just talk about the medical people. We also have Temi, who was a lawyer and he transitioned into business analysis. We have Osabo, who was, a sales personnel. She transitioned into business analysis. We have Ngozi, who transitioned from being a customer service rep into business analysis, and she landed a fully remote job. All right. We also have people who are, very fresh, no tech background, nothing. You don't even have any background at all. All you know is you take care of your kids, but you want to do more for yourself. We have helped people like that also transition into tech. Now, the truth is, employers don't just want to see your certifications. They don't just want to see your beautiful CV that we're going to work on for you. They want to know that you can do the job. Now, the $1 million question here is, do you have the experience? That's what they want to know. I tell people over and over and over again that there are no entry-level jobs. If you get an entry-level job, it's purely a stroke of luck. Okay, because even when you see entry-level jobs, sometimes when you take a look at the job description, you see that they're requesting for at least 1 year of experience. So you're asking yourself, me that is a beginner, that I'm trying to just make this transition, how do I get this experience? And that is where Tenalytics is. That's what we do. That is the bridge that we're able to, help you. That is a gap we're able to help you bridge. Now, I'm going to go ahead to explain these 3 different roles, and I'm going to be speaking specifically to certain people on this call. Now, if you're on this call, you're listening to me right now, and you would consider yourself an extrovert. You consider yourself as someone who loves to think on their feet. You're a fast thinker. You love to have strategic conversations. You like to have meetings with people. You don't mind having meetings. You don't mind speaking to people, having meetings with different people, optimizing processes, making things work better, looking at, the way things are working and saying, I think there's a better way this can work. I want you to put BA in the chats. All right, because if you're someone like that and you're listening to me right now, then the business analysis path is for you. All right, now a business analyst acts as a bridge between the business stakeholders, which I like to call the money guys. All right, these are the board of directors at the NHS. These are the, the people who are at the top level, the C-suite executives. All right, the business analysts act as a bridge between those guys and the technical teams in order to ensure effective communication. So I want you to think of yourself as an interpreter. What it means is you are interpreting for people. So you are, these people speak French. These people speak Spanish. So you are the only one in between that understands both French and Spanish. So when these people are speaking French, you're able to get what they said and interpret it to these people that speak Spanish. That is your job as a business analyst. And then you get to optimize processes. You get to look at a process, look at this particular process, and you say, I feel like we can do things better. I feel like there's a better way we can approach this to get better results. I'm going to use one example very briefly because I'm also trying to make sure that we get clarity from this call. You're able to pick one of the programs that you would like to attend or one of the programs you would like to register for. I'm going to give a very short analogy, of a business analyst and the role of a business analyst in an organization. Now, before I go into it, I also want to mention that organizations everywhere are looking for business analysts or people who have business analytical skills, people who have the business acumen, because you're seen as problem solvers. When an organization has a problem, they're looking for a business analyst to help them solve that problem. It doesn't matter whether it's in the healthcare sector or in any other sector. Now, I'm going to use the banking sector back home in Nigeria. way back when, way back in the 90s. All right. Before we got ATMs, I think they're called automated teller machines, right? Right now, I'm sure in every street in Nigeria, you have ATMs everywhere, but it wasn't always the case. All right. So before, way back then, you had to go into the bank, anything that had to do with your money, regardless of how little you wanted to send, you had to go into the bank. You have to join a very long queue, stay on that queue for possibly 2 hours, and you wait on that queue for a long time. When it's your turn, they ask you questions. They start to ask you questions. Who do you want to send money to? What is this money for? How much is the money? What bank does this person use? They ask you questions that you have to answer till they're satisfied. And when they're satisfied, they give you a slip or a form to go and, fill that form before you can carry out a transaction. Now, what you do is you take that slip after waiting for 2 hours or 3 hours, by the way. You take that slip, you sit somewhere and you fill the form. Now, after filling the form, you have to join another long queue in order to carry out that transaction. So if you know the banking sector back then, it was always full. It was always chaotic. The banking halls were always filled to the brim. You always meet a queue, a very long queue of people at the bank every single time. Now, a business analyst walked into this banking sector, looked at the processes and said something is wrong with this process. This doesn't make sense, because why do we have to tell people wait on a queue for 3 hours to get a sleep? Is there no better way we can do this? How about we do it this way? How about we get different tables that we arrange? So we arrange different types of forms or different types of slips on these different tables, and then we get one person to stand at the door. So when a user or a customer walks into that bank, they say, "Good morning, how may we help you today?" And this person says, "Oh, I'd like to make a deposit." That security personnel at the door is able to say, "Do you see that table by the far left? Do you see that red table? Please go to that red table, pick up a form and fill it." Or, "Do you see that counter by your far right? Please, can you walk up to that counter? You're going to see some forms there. Just take one form and fill the form." Now, do you know what just happened here? A form that would have taken you 3 hours to get before is taking you 2 minutes or 1 minute to get. That is the role of a business analyst. So if you think you're a problem solver, you'd like to look at complex problems, operations, or the way we are, admitting patients, the way we are collecting patients' information, the way we are collecting patients' data, and you are thinking of a way to make it work and work better, the business analysis program is for you. You can go ahead to register for this. Now, the business analysis program is a powerhouse, all right? One of the most versatile programs here at 10 Analytics, and for very simple, very strategic reasons. Now, the business analysis program is a 3-in-1 package. I feel like when a lot of people hear this, they'll want to go for business analysis. But the truth is, it's 3-in-1. So in the business analysis program alone, you have data analytics embedded in it, and you also have project management embedded in it, and finally, business analysis. So in one program, you're getting data analytics, you're getting business analysis, and you're getting project management. So you learn, in as much as you're learning how to be a business analyst, you're going to learn how to think like a data analyst. So what that means is when you see job openings for data analysts, you can apply to those jobs. When you see job openings for project managers, you can apply to those jobs, because we're going to teach you how to think like a project manager, how to execute a project. How do you initiate? How do you plan? How do you execute? How do you monitor? And how do you close a project? Just the way a project manager would. All right, we actually have a lot of participants who have finished this program and landed jobs as project managers. So what that means is, it opens up more job opportunities for you. If you see job opportunities, healthcare data analyst, you're able to apply. All right. If you see anything relating to project management, you're able to apply because you have the skills. If you see business analysis, process optimization, you're able to apply as well. And then we'll also teach you, one thing is very common across these 3 different programs I'm going to be explaining. We'll also teach you how you can leverage AI. Now, I talked about job security. We know that AI is on the rise. Everybody's talking about AI. Everybody's scared of AI coming to take their jobs. Now, we are going to teach you how you can leverage AI as a business analyst, as a data analyst, as a data scientist, because there's one thing I always tell people. AI is not just going to come from nowhere. It's not like when we watch all these movies and shows, you see a robot walking. That's not how it's going to happen. We're not just going to all of a sudden robots will take over and kill all the humans. No. The way AI is taking over jobs right now is by working with people. So it's not, what I'm saying in essence is that no robot is coming to take over your job. The people who learn how to use these robots are the people who will take over jobs. So it's not enough to just be a business analyst. It's not enough to just be a problem solver. If you don't learn how to leverage AI, you're going to be obsolete in the next 2 years. Because business analysts who know how to use AI will collect your job from you. So what we did was we make sure to add AI to the curriculum. So regardless of any of these programs you're going for, business, data analytics, or data science, you learn how to leverage AI. Now, let me explain the timing, the structure of these classes, as well as the duration. Now, it's the same across the 3 different programs. The duration for this program is 8 months. You have 6 months learning in class, and then you have 2 months of internship. Because again, we're not just concerned about you learning. We also want to make sure that you're able to practice what you learned to also build your skills and your experience. Now, in as much as you have 8 months learning in class, what that does not mean is that you have to wait 8 months to land a job. All right, I shared stories of people who landed a job 3 months in, 4 months in. We have a lot of people that land jobs while in the program. All right. But the program itself, the duration is 8 months. And then for the classes, you have what we call live classes that happen on Saturdays, right? 2 Saturdays out of 4 Saturdays in a month, you have a live class. All right. And then you have 2 different timings for these live classes, morning class and the evening class. Now you're able to pick according to your schedule and say, you know what? On Saturdays, I work in the mornings, but I'll be free in the evenings. So I will attend the evening class. Or I work in the evenings, but I'll be free in the morning. So I'll attend the morning class. You're able to pick. Also suitable to, for different time zones. So if you're in the US, the best class to join. If you're in the UK, the best class to join, and so on and so forth. Now, the morning class runs 11 a.m. to 2 p.m. or 3 p.m. West African time. And the evening class runs 6 p.m. to 9 p.m. West African time. Now, these live classes, the reason you have them 2 times in a month, right, is because I like to call them marathon classes. Now, these classes are no joke. These are very intense classes. These are classes where you join and you work on projects. So you'll be on a call for like 3 to 4 hours working on different projects. Now, that's why you have it 2 times a month, because we don't want to overwhelm you. We cannot tell you every day, 4 hours, you have to attend a class, especially when you have your real life to juggle. All right. So you attend these marathon classes 2 times in a month. And if you miss any class, it's okay. You have the recording of that session that you can watch. And then if you have any questions, there are 2 different avenues, actually 3 avenues that you can ask your questions. The first one is a pod. You have what we call a pod, which is like your study group. So we have also, observed and we have learned that it's easier to learn when you're in a group. So you don't feel alone. So when you see something that you don't really understand or you don't really know, you're able to ask your people, your study partners, your study group. Hi guys, I saw XYZ. Elizabeth said XYZ in the last class. Please, did you understand it? Can you explain to me? You're able to get that peer-to-peer guidance. Someone can explain to you. You're able to learn from different experiences and also, of course, connect with people. All right, network with people. Now, aside your pod, which is your little study group, maybe 4 to 5 people, you also have a closed WhatsApp group chat for your class, your entire class, right? Where you have your facilitator on. So if Elizabeth is on your facilitator, I'm going to be in the, Elizabeth is your facilitator, Elizabeth is going to be in that WhatsApp group chat. So when you have a question, maybe you asked your pod and nobody really knows, everybody does not understand. You can go on the group chat and tag Elizabeth and say, hi, Elizabeth, I have a question about XYZ. Please, can you explain further? Now, that is the second avenue. Now, the third one is what we call drop-in sessions. Now, for business analysis, I want you to listen carefully. For business analysis and for data science, your drop-in sessions happen 2 times a week. So once on Wednesdays, 9 p.m. West African time, and then the Saturdays when you don't have your marathon live classes, you have your drop-in sessions. Now, it's very important to note that the drop-in sessions are also live classes. It's just that the reason why we give them a different name is because they're shorter. So while the live classes, the marathon live classes will go 3 to 4 hours, the drop-in sessions will go 1 to 2 hours. All right. Because we want to make sure that we're not just leaving you on your own to go and figure out things by yourself. We're still providing guidance, but we don't want to overwhelm you. So twice a week, you get to be able to join a session that would also be recorded. If you have questions, if you need extra explanation, if you missed a class, you can say, hi, Elizabeth, I missed the last live class. I've watched the video, but there's some things I don't understand. I wrote them down. Let me bring out my book and please, let me start asking you questions. Or I'm trying to work with, really understand, please, can I share my screen? There's something going wrong. You're able to get that guidance. Again, you get hand-holding with analytics. All right. And then aside drop-in sessions and live classes, you get your self-paced videos, which I talked about earlier. Videos you can watch, pre-recorded videos you can watch anytime, anywhere, on your way to work, on your way back to work, when you're doing the dishes. You're able to watch these videos at your own time. You can pause it, come back to it, replay it as many times as possible. If you have questions, you write it down and you go ahead to ask your questions using those three avenues: your pods, your WhatsApp group chats, or your drop-in sessions. That is how the learning here at Analytics is structured. Now, let's move on to the next program. Now, let's talk about the data analyst. Now, if you're on here, because earlier I talked about, people who feel like they're extroverts, people who are very comfortable, now, if you have any questions, please go ahead to put your questions in the chat, because once I'm done, I will also go ahead. I see some questions, not to worry. Once I'm done with the entire presentation, I'll now go through the questions in the chat, one after the other, and answer. All right. Now, I see a question from Simon. I see, a comment from iPhone as well. Fantastic. Now, if you feel like you're an introvert, you are the opposite of what I explained for the business analyst. You don't really like meetings. You would rather do your work in the background. Maybe you don't want 1 or 2 meetings, but you don't really like to speak to people. And if you're also in a country where there's a language barrier, all right? If you're in a country where there is a language barrier, you want to make sure that, I don't really want to talk to people and so on and so forth, then you want to go for data analytics. If you would like to work in the background, data analytics. If you would like to work at the forefront, business analysis. I believe with this explanation, a lot of people on here, if you are already you're picking the place for you, or the program or the career path for you, I want you to give me a thumbs up. Right now that, I'm an extrovert. So if I'm an extrovert and I enjoy speaking to people, I should be going for business analysts or business analysis. Now, if I'm an introvert, I don't really like speaking to people. I like to work in the background, send in a report. I should be going for data analytics. I want you to put a thumbs up. I don't see anybody putting in a thumbs up. Are we asleep? Should I end the session? Don't we like what I'm saying? Should I go? Okay, thank you, Adekunle. I need at least 2 more people, so I know that we're still here. Thank you, Kenny. 1 more person. Thank you, iPhone. All right, fantastic. So I think some people are listening to me. Someone says, is BA also remote? All 3 of these programs, business analysis, data analytics, data science, all remote. Okay, if you want remote jobs, if you want on-site roles, if you want hybrid, all of them qualify. All right, now, as a data analyst, you work in the background. Data analytics, very simple. Data analytics, very, very simple. Sorry, I think my screen has just paused. Give me a minute to bring that back up. Give me a minute to bring that back up. Give me a minute to bring that back up. Data analytics, very, very simple. Data analytics, very simple. One of the easiest programs to join. All right, I'm trying to bring up my screen. Data analytics is one of the easiest ones to join. Anybody can be a data analyst. Anybody can be a business analyst as well, to be fair. But anybody can be a data analyst. All right. So now, if you enjoy working in the background, all right, and then you don't want to really interface with people, you don't want to really be speaking to people all the time, right? You can go for the data analytics program. Now, as a data analyst, what is your job? What is your role? Your role is to interpret data. You need to analyze and interpret data for organizations. All right. Your role is to analyze and interpret data for organizations. It doesn't matter where you're working, whether you're working at the NHS, right? Whether you're working anywhere, they have data, they have patient information, patient data that you need to analyze and make sense of for them. That is your job as a data analyst. What that means is that the data is available. Nobody's telling you to go and look for the data. It's available. But these organizations, anyone who is not a data specialist would not understand the data. So if you're on this call, you have no background in data. If they present some data to you, you might not necessarily understand. So what that means is these organizations, as big as they are, whether it's the NHS, whatever it is, as big as they are, they need a data analyst to help them make sense of their data for them, right? Now, let's also paint another scenario for data analytics so that we can use that to explain, explain the role of data analytics in, I'm going to use the healthcare sector now. So say you currently work at a hospital, right? And let's say this is December of 2025. The hospital, we're trying to round up, for the year, we're trying to, and then we're looking at our performance from January 2025 to December 2025. And we find out that we have treated 10,000 patients so far, right? Now, as a data analyst, you answer two questions for that organization. What happened and why it happened? The what and the why, literally. What happened and why it happened, using what we call descriptive analysis for what happened and diagnostic analysis for why it happened. Those are the questions that you answer, those two questions. So now this hospital, they find out that they treated 10,000 patients in the entire 2025, but they are trying to understand, what departments did we really get most patients? What department did we treat most people? Which of these departments had the most patients? Which of these departments had the least number of patients? And why did some departments get more patients than other departments? All right. Why did some departments get more patients than other departments? Because sometimes, you see that you're seeing that, this department is treating more than this department. Why? You want to understand that. And that's where the data analyst comes in. So let's say, Adekunle is a data analyst, and he's a data analyst at the NHS right now, or a hospital. Let me not call names. A hospital, right now. Now, Adekunle, they come to Adekunle and they say, Adekunle would like to understand. We saw that we treated 10,000 patients in 2025, and would like to understand why we treated these people, how come, where, and all of that sort. They're trying to understand that. What you need to do, Adekunle, is that you carry out what we call the descriptive analysis. That's the first analysis. Now, when you carry out the first analysis, you find out that, okay, yes, we treated 10,000 patients, but you're able to now break down those 10,000 patients according to the regions that it came from. All right. So you now say, okay, so not just the regions now, but actually the departments in the hospital that these patients were treated. So you see that, okay, out of 10,000, we had 5,000 pediatric patients. So 5,000 children, basically, right? We had 3,000 people in the emergency ward. We had 1,000 people in the cardiology department, and so on and so forth. You are able to give them specific numbers. How many patients were treated in each department? Okay, how many patients got a hip surgery? How many patients did this? How many patients did that? You're able to tell them. Now, the truth is, you didn't have to be there. It's not like you had to have been employed from January to December to be able to, even if you joined the organization, you're just joining in that December, you're able to access the data and tell them what happened in January, what happened in February, and so on and so forth. All right. Now, the second question is why? Because when you tell them we treated 5 people in cardiology, 5,000 people in cardiology, 1,000 people in pediatrics, and so on and so forth, they're going to ask you why. This is a school zone, for example. How many people did we treat in trauma? And you say maybe we treated 500 in trauma from January to December. Why? And then you carry out what we call your diagnostic analysis. And when you carry out your diagnostic analysis, you then find out that the reason why we treated only 500 people in the trauma department was not because people were not getting accidents. People were getting a lot of accidents. In fact, in this district, we had at least 1,000 accidents alone in 2025. But they were not getting rerouted. They were not getting routed to our hospitals. Or even when they bring them to our hospital, they get rerouted to nearby hospitals. Why? Because there was a long patient wait time. What that means is that you find out that some departments are understaffed. So for example, let's say we treated 5,000 people in the emergency department. You now find out that the reason we treated those 5,000 people is because, we have like 15 doctors or nurses on shift at any given time in the emergency ward. So what that means is once people are walking in or once people are being wheeled in, somebody's attending to them in the next 2 minutes. So of course, it's like a revolving door. As they're being attended to, more people are coming and so on and so forth. And then you find out that in trauma, we only have one trauma surgeon, just one person. So yes, even when they bring in, trauma patients, because we are understaffed, before the one person would be able to attend to these people, some people are waiting for 1 hour, some people are already waiting for 3 hours. Then because those cases are critical, they get rerouted to nearby hospitals. You have been able to pinpoint a problem for that hospital that you work in. You have been able to tell them, look, we're bleeding money, because at the end of the day, it translates to money, right? we're bleeding money as a hospital because our trauma department is understaffed. So every time they bring in people, because of the long wait times, they get rerouted to other hospitals. They get referred to other hospitals. So we're literally taking our money and we're giving it to other hospitals. That's what it means. Now, as a data analyst, what you have just been able to tell that hospital is that, look, this is the place where we are doing exceptionally well. We're doing very well in this area. And this is the area where we are doing poorly. We're not doing well at all. Now, for 2026, for these hospitals to plan for 2026, with their data, you have been able to help them make a very clear decision. So they know, they say, oh, Adekine, so what you're telling us now, if you can get more trauma surgeons, more qualified trauma surgeons, have more people on shifts at any given time in the trauma departments, right? When we get these patients in, we're able to, at least attend to them on time. And of course, increase the number of people we treat in that department. That is your job as a data analytics, as a data analyst, pure and simple. All right. We're able to, make these decisions based off of your data. So you are literally, you see how important you are. Yes, you might not be a CEO. All right. You might not be a C-suite exec. You might not be on the board of directors, but what you are literally telling them is going to shape how the company would move forward, how the hospital would move forward. Now, I usually refer to the data analysts. When we talk about the data brothers, that's the data analysts, the data scientists, the data engineers. I refer to data analysts as the last born, the youngest child. Why? Because very simple. If you know you don't want anything that's going to stress you, you're not even ready for stress right now. You want to get into healthcare informatics, you want to get into, biostatistics, you want to get into clinical analytics, you want to get into, and you don't want something to stress you, then go for data analytics. All right, because this is the last born, this is the youngest child. Very simple. Anybody can be a data analyst. Now let's move on to the elder brother of the data analyst, which is the data scientist. Now, I mentioned earlier that the data analyst answers two questions, right? What I neglected to mention was that the data analyst answers those two questions using what we call historical data. I mean, historical from history, meaning as long as that thing has happened, whether it happened this morning, it happened yesterday, it happened last month, it happened last year, it happened 5 years ago, as long as it has happened, a data analyst would answer those two questions using that data. Now, a data scientist, being that he or she is older, is the older brother or the older sibling of the data analyst, the data scientist can answer three questions. The data analyst can only answer two. Now, the data scientist can answer what happened, why did it happen, just like the data analysts, but then the data scientist can go ahead to tell you what will happen in 2027, what will happen in 2028, what is going to happen in the future. So the data scientist can tell you, based on this data, it's not magic, by the way, based on this data, this is what is going to happen in this hospital in 2027. Now, do you see how this is a wonderful skill to have? And you're going to be able to do this as a data analyst using predictive and forecasting, analytics with Microsoft Excel. Now, the data science program is a bit more technical than the data analytics program, which is why I said is the elder brother. So because the data scientist is the older brother of the data analyst, the data scientist can do everything that the data analyst can do it better, and then do more. So of course, you start to go into coding. You start to get into the technical parts of tech. Now, if you know you're not interested in taking on new challenges, please, you feel like life has challenged you enough, you don't want new challenges, you want something simple, go for data analytics. You want something simple, you don't want new challenges, and you want to work in the background, go for data analytics. If you want something simple, but you like to work in the forefront, you like to have meetings, you like to speak to people, go for business analysis. But if you're open to a challenge, if you're like, you know what, I'm a smart person, right? I'm open to challenges, I would like to learn coding, then go for data science. Because remember, this also opens up more job opportunities for you in the sense that you are able to work, you're able to apply to any job a data analyst can apply to. You can also apply to it. You are even more qualified than the regular data analysts. And then, of course, you have data scientist roles to apply to. Biostatistics, right? A lot of healthcare informatics roles that you can get into with this particular, program. So now I want to listen. Basi says none is better than the other. I see. So now I want you to put in the chat as well. If you Want something simple, you're very confident or conversant, you like to communicate with people, put BA in the chat. If you want something simple, but you're an introvert, you like to work in the background, put DA in the chat. If you don't want something too simple, yes, you want to work in the background, but you are interested in coding. You don't need to know how to code, by the way. You just need to have interests. Put DS in the chat. Now, I hope with this few points of mine, I've been able to convince and not to confuse you. Now you know the best career path you can get into. I see BQ says DA and DS. Now you can decide on which one. Just pick one. Do like a blind pick. Pick one and go ahead to register for that program. All right. Now let's move on. The learning timeline stays the same. The live classes stay the same as well. Now, how do you get a job? What is the formula that you use? What is the mathematical formula that you use to get a job? All right. So the mathematical formula is simply T plus E. That is the formula we use here at Analytics, right? It's not dy dx. It's nothing complex. It's simple addition. And T stands for technical skills. E stands for your employability skills. I'm not going to be speaking on this too much because I feel like I've done justice to it. Now, your technical skills are those things you learn if you go for business analysis, if you go for data analytics, if you go for data science. Oh, you're learning AI, you're learning machine learning, you're learning how to use AI as a business analyst, you're learning how to do this and do that. Those are your technical skills. But I'm sorry to tell you that your technical skills are not enough to get you a job. Now, you might be saying, Elizabeth, you're starting to contradict yourself. You said we don't need a certificate, but now you're telling us that the skills alone is not enough to get us a job. Just listen. Your technical skills will take up only 50% because you could be the best data analyst and struggle to land jobs. So in order for you to land a job, you need to also have the E aspect of it, which is your employability skills, which is what I mentioned earlier, a good CV. We work on your CV for you. We teach you how to optimize your LinkedIn profile, how you can position yourself. We have sessions with you. We teach you how to navigate the job market, how you can get the upper hand in the job market. We teach you, we prep you for interviews. All right, we prep you for multiple interviews. We tell you how to answer. So, hey, Adekunle, when you got this interview, okay, now this company, we've done our research on them. These are the kind of questions that they will likely ask you. Now, when they ask you this question, Adekunle, when they ask you this question, Bolaji, this is how you should answer it. This is what you should say. This is the project you should talk about. Now, we are giving you a full-on prep. It might span 1 hour, 2 hours, like we're prepping you so that by the time you go for the actual interview, you are at least 70% ready. It doesn't matter the question they throw at you, you know how to tackle that question. All right. We also offer job reference letters. When you need to get a reference or recommendation letter, we're going to offer you one. You just have to reach out to us and we'll provide you with that. We offer you on-the-job support. All right. You land a job first month, you don't know how to go about things, you get a hard task. We have people that, they're registered for a program here at Analytics. They already have their jobs. They're already working as data analysts or data scientists, but they landed the job purely out of luck. Now they are in the job, they're getting tasks, they don't know how to do it. So they come to Analytics, they register for the data analytics program. And while they're in the program, we're also supporting them, assisting them, teaching them how to carry out those tasks that they are getting at their workplace or at their job. All right. Then weekly mentorship sessions and of course, Upwork optimization session if you're looking to freelance. Now, after all of these things that I've said, how do you get started? You just need to join our next cohort. If you have identified the program you would like to take, business analysis, data analytics, or data science, go ahead to join the next cohort that starts on the 7th of February, 2026. Now, we have a 20% discount running. And this 20% discount is for the people on this session. Now, I'm looking at the number of people on this session. We are more than the slots we have available. We only have 20 slots for this discount. I can see more than times 2 of that number, right? So at this point, it is, it's not slow and steady wins the race anymore. It is grab your copy as fast as possible. Now, it depends on the people who are able to register the fastest, they get a discount. Now, the pricing of our program, because I saw someone ask, how much does it cost? Whether you're going for business analysis, data analytics, or data science, the pricing is $1,250 or £958 if you're joining from the UK. That is the original price of the program. However, with the discount right now, you're able to pay $1,000 or £766. And you're able to spread it across 5 installments. What that means is you can say, hey, I want to get in with this discount. I want to be among the first 20 to make payment for $10. I don't have £766. All right. Can I pay little by little? Can I pay small? And the answer is yes. There is a payment plan. All right, I'm going to walk you through that. My colleagues must have been dropping the link to register in the chat. Make sure you click on that link. Now, let me show you how to go about the registration. Just give me a minute. Let me show you how to go about this registration. Now, if you're looking to take a Analytics program, I believe you can see my screen. Once you click on the link that my colleagues are sharing right now, the link that my colleagues are sharing with you, you should see a list of all the programs that we offer. Remember what you are concerned with: data analytics, business analysis, or data science. Forget about all the rest. All right. So you see data analytics, that's the first one. Business analysis is the second one. Full stack data scientist is the fifth one on the list. So those are the 3 programs you should be focusing on. Now, you want to click on buy now. So when you identify the one you want to go for, if you want to go for business analysis, if you want to go for data analytics, and so on, you click on buy now, and then it opens up the program description. Every single thing you need to know about the program, you see it here. So you are able to see what the course is going to look like, what the curriculum is going to look like, course instructors, and so on and so forth. All right. Now you want to click on this button that says enroll now. Remember, first 20 people. You want to click on this button that says enroll now. You'll be asked to create a free account with us. Your name, your email address, and your phone number. Literally, that is all. Now, once you create that free account, you'll be able to confirm your enrollments. Now, because we're trying to be very inclusive, we know that we have some people, trying to register for this program from Africa, Nigeria, South Africa, wherever you are. So we also accept multiple currencies. So you're actually able to switch your currency here. All right, there's a currency selector right here. So you see it right now. I put it on Naira to talk about this. So you're able to see the equivalent in Naira, but I can change it to US dollars now here. I can also change it to pounds. I can also change it to euros. I can also change it to Canadian dollars, but I'm going to put it on pounds and use pounds to just walk you through the payment. So regardless of your currency, just know that you're able to switch your currency and pay in your local currency. So you're going to see the equivalent in pounds, the equivalent in Canadian dollars, the equivalent in USD, and so on and so forth. So you don't have to worry about having to convert your money. Now, here is the payments plan. I remember I said you're able to split your payments for as many as 5 times. So what that means is you can say, I have all the money right now. Let me pay everything. Or I would like to pay 2 times, or I'd like to pay 3 times, or I'd like to pay 4 times or 5 times. All right. All you have to do is just select your preferred payments plan. Now, I neglected to mention, before you select the payments plan, you're also able to register in advance. So even if you feel like, oh, February is a bit close, I'll be busy in February, I can't do this in February, you can register ahead for the March class. All you have to do is select March. All right. So you can actually register ahead. Once you select when you would like to start, you go ahead to select your preferred payments plan, the payments plan that is most convenient for you, and you click on apply discount. Now on this page, you get a breakdown of what you're going to be paying. And then you see your next payment date. Yeah, now you're also able to edit. What it means is that the next date that your next payment will be due, basically. So you make a payment of, say, £153 right now, because that's the minimum deposit you need. If you have £153 right now, I need you to hurry to the enrollment center and register for a program, because that's the minimum. If you have $200 right now, hurry to the enrollment center and register immediately so that you can access the discount, because you get to save about $250. That's a lot of money. Where I come from, that's a lot of money. All right. Now you see the next payment date here, and it's telling you that, oh, if you make payment today, 14th of January, the next time you'll be making payments is 14th of February. Now, what happens if you think about it and you say, I don't get paid on the 14th of February, I actually get paid on the 28th of February? All you have to do is edit the dates. So you can select the 28th of February and save it. And you see that automatically it edits your, the following dates for you. So you don't have to always pay 14th of February, no, 14th of January, 14th of February, 14th of March, and so on and so forth. You're able to pick a convenient date for your next payment. So once you're done with that, you just want to go ahead, confirm that all of your information is correct, and click on Pay Now. Now, once you click on Pay Now, it's going to ask you to put in your card details. So that's why I'm not going to show that part. But just like that, you are in, and that is how you're able to secure your next job in healthcare informatics. Now, I'm going to be looking at the questions. Remember to fill the slides, the attendance form, because there's still so much on my slides that I've not shared with you. All right, you see the discounts that you get. You see the certificates that you get. You see every single thing. So many information. I can't go through them. We're going to sleep here. You're going to even see more success stories, more people. You're going to be able to watch their videos and so on and so forth. So what I'm going to do now, I'm going to be taking a look at the chats, and I want to see if there are questions for me in the chat. So I'm going to start taking your questions. I'm going to start from the, let's scroll up. Let's see. Okay, so someone says, please, how much is the fee for data analytics novice? 1,000 US dollars. That's Bismillah. I hope I pronounced that correctly. Bismillah, 1,000 US dollars. Or 766 pounds, depending on where you're joining us from. But you need a minimum of 153 pounds. If you have 153 pounds right now, go ahead to register. Kemi says, so is project management not in high demand? Don't get me wrong, project management is in high demand. But remember what the topic for this session is. If you want to get a role in healthcare informatics, if you want to get a role in project management is in high demand, all right? But healthcare informatics, that is the focus for this session. Healthcare informatics, you should be looking at data analytics, business analysis, or data science, all right? Simon says, if you register for everyone cohorts, or maybe he says, if you register for any cohorts, do you get access to the courses immediately, or you can't access it until the cohorts get started? So you actually get access to some materials, you get access to some videos on installation, the tools you need to install, and all of that. So we make sure not to also just grant you access to too many things, because you get overwhelmed. You go and start reading what you don't even understand step 1. You've already started reading step 5. So we want to make sure that by the time you get into class, you're able to move at a pace that would work for you. Okay. Jalila says, please, I already started my training. I saw the email to join the session. All right, you can leave the session. All right, let's go. I see Simon says, if you register for a cohort, okay, I answered this question already. If you have more questions, put it. iPhone says, excellent explanation on business analysis, character interpreter. Fantastic. Adekunle, okay. Ifoma says, is BA also remote? Yes, it is. 101%. So right now I'm just taking questions. Samsung says, can you explain data science? I just did. All right. Oti says, I apologize for my late arrival. Okay. Oti, I want to believe that you have filled the attendance form so you can have access to the slides. Chukuma's family, the entire family, wow, says, thank you for this information. Please, what is the difference between health data analytics and health informatics? All right. Now, what is the difference is in the job description. Okay, it's in the job description. In fact, the two can be used interchangeably. All right, just know that, oh, you want to be a data analyst in the healthcare space. These are the kind of jobs you can apply to. Health informatics specialist, health informatics analyst, health data analyst, data pathology analyst, and so on and so forth. The difference is in, some organizations like to use fancy names and also in the job description. But as a data analyst, you can do these two roles that you just mentioned, Chukuma's family. All right, Basi says, and last bonds get preferential treatments than others. Basi, I beg to disagree. Okay, I beg to disagree. I'm guessing you're talking about the data analyst and the data scientist. I beg to disagree. Ifoma says Python. Yes, you'll be learning Python in data science. So if you're not ready for Python, Ifoma, I can see you're not ready for Python. Just don't stress yourself. Go for data analytics. Just mind your business. Don't stress yourself. Go for data analytics. iPhone says, so data scientist is better than analytics, right? Well, if you look at it from that lens. But remember, as a data scientist, you are more advanced than the regular data analyst. You can do everything that data analyst can do, and you can do more than that data analyst. So I'll leave you to draw that conclusion on your own. Okay, let's keep scrolling. More questions. Kenny says, I love the challenge, but at the moment, okay, maybe there's a typo there. I love the challenge, but at the moment, I'm still schooling. So I take the easy routes to be realistic. 100%. There's no shame in that, Kenny. So go for data analytics. Now, tech is very fluid. Even if you love the idea of data science, but right now you know that you're like Kenny, you're schooling, you can go for data analytics, get a job first. All right. Start earning your six figures and then transition into data science. And then it will be much easier for you because you have gotten your foot in the door. I tell people the hardest thing to do in tech is to break in. Once you break in, you can be anything. You can wake up and say, I want to do cybersecurity, and you can do it. All right. Herbert says, I like the way you differentiate with those career paths in a layman's way. Thank you, Herbert. Please go ahead to register. iPhone says, true, with the way she explains, I already see myself getting a high-paying role. That could be your reality if you register for the training. All right. The New Year offer is on. My colleagues have put the link in the chat. Someone tagged me at Elizabeth Nana. Is it advisable for someone on skilled worker visa in healthcare 3 years to do this program and get a sponsorship with the said rules? 101%. I see my colleague Elijah just responded to you. Yes, it opens you to land more visa sponsored roles and it doesn't affect your current visa. All right. All you do is you switch. So you're not starting over because I know you're already 3 years in. So I guess that's the fear. You're not going to start over. You're just going to continue from 3 years, 4 years, and then 5 years. All right. Let's see. Herbert says, did you say doing a BA you can do becoming? Did you say doing? Okay, I see my colleague has answered the question. I'm not quite sure. I think there were some typos in that question. All right. iPhone says salary for health informatics. Can I get this role remotely from Africa? In the US, it's roughly around $110,000 average. All right. In the UK, it's roughly around £83,000. And yes, you can get it remotely from Africa. All right. You can work, you can be in Africa, land one of these jobs, and you're working in Africa, you're not relocating, you're not moving, you don't need visa sponsorship, and you're able to work from your location for that organization. All right. Bukola Mi says, thank you for this session. Can you advise what course I can enroll for someone working in health and social care as a deputy manager? Bukola Mi, only you can answer that question. Are you an extrovert? Do you enjoy meetings? Do you enjoy speaking to people? Apply for business analysis. Are you an introvert? Do you enjoy working in the background and you want something very simple? Apply for data analytics. Are you an introvert, but you're open to a challenge? Apply for data science. So only you understands your personality. If you're an extrovert, business analysis, introvert, but you want something simple, data analytics, introvert, but you're open to a challenge, data science. I hope I've been able to answer that question. Okay, let's see. Let's go. BQ says your explanation has convinced me, so I am considering. So I think that is that about the questions. Thank you so much, everybody. It was a pleasure, just joining the session, listening to people like yourself. Very happy I was able to at least provide clarity to some people, maybe not everybody. That's okay. If you need extra clarity, all you have to do is indicate, all right, that you need extra clarity. But I hope that with this session, just based off of the explanation and also the key differentiators, all right, you knowing your difference, your personality. Merit says, what if I'm unable to commit to classes due to my work? Merit, that's why we have 2 classes a month, and that's why these classes are always recorded. So even if you miss a class, you have access to the recording, and then you have access to your facilitator on WhatsApp. So you're able to have a quick call, have, Mondays to Fridays for data analysts to I must have missed your message, Zoom user. You want to put that again. So Mondays to Fridays for data analysts, you're able to schedule a call at your own time with your facilitator. You say, 12 p.m. on Tuesday, I'm going to be free. Let me schedule a conversation with my facilitator, right? Let me have a meeting with my facilitator. So that is for people like yourself, Merit, who, because of your tedious schedule, you're unable to really commit to your classes. All right. So Zoom user, put your question in the chat just before I end this session. I must have missed your question earlier. Hurry up, go ahead. I'm about to round up. Thank you, everybody, for listening to me. Okay, thank you for listening to the sound of my voice. Very happy to be here. And I hope that